respected senior past and present IMA leaders and chairpersons on the dais and my fellow young doctors, it's a great honor to be here. I'll be very brief. I think we are running short of time, so let me just try to convey what I wanted to convey to you in a very short and sweet way. Now, good doctors can be great administrators, so hospital administration as a career is a topic that I chose to talk to you. Now, today is the Happy Young Doctors Day, so I really wish every young doctor a very happy Young Doctors Day. Now, in the past, I think, as you all know, in our generation, as a doctors, we were only known as caregivers, or we could be scientists, or we could be educators like professors and assistant professors. Now, that's not the case anymore. That's the blue ocean approach. As you can see, the people on this slide are all doctors. And we can all be proud that all these doctors have been instrumental in creating as educational and various hospital systems and network of institutions. Now, why doctors should consider administration as a career? Now, with your clinical knowledge, after MBBS, you've learned a lot about clinical disease, about patients. And with that, when running in a hospital, all you need to know is how to ensure the care is being given to the patient, which can be given in a much better way. So lean management is one simple topic that where you can actually chip in and be a very good, useful tool by giving the highest standard with less number of people. And in terms of people-centric care, I think patient-centric and people-centric care are going to be the future, and it has been always the future. And in terms of innovation, I think this is one topic which you can all know that physician leaders can actually have crazy ideas and make people under them deliver more. Like one of the first cardiac surgery was done in Cleveland Clinic, which was run by a doctor who gave a free hand to a doctor to experiment and do the first CABG. Now, you may all know when and who should become a hospital administrator. You've all finished MBBS, you can be choosing. We all want to be differentiator. Right from our +2, we want to differentiate. We didn't want to become an engineer, we became a doctor. Now, after doctor, a postgraduate. Now, in addition to postgraduate, if you think you have logical, critical thinking, problem-solving capability, and leadership techniques, you have another opportunity. Now, what is a path that you can choose after your MBBS to become a hospital administrator? You need to have an education system. So, education is something which will empower you to become a very efficient and skillful hospital administrator. There's various MBB, MBA. Next 3 slides will quickly pass through to see what are all the choices that you have got. Now, by doing an MBA or a hospital administration, you can actually create a community impact. You can become a very senior person in WHO, where you can run a program, like for example, a state AIDS program can be run by you. You can design a program, you can get the budget, and you can run it. You can be an entrepreneur. You can start your own hospital chain. You can start your own colleges. You can be actually running a hospital as a CEO, and you can be standing out from the crowd. Now, there are various full-time courses. You can see I just skipped through. You can actually Google and find out what are all the courses. All things will be available in Google. Now, there are work integrated courses. BITS Pilani offers an MPhil program, which is a 1.5 years on-campus and off-campus program. There are various programs being offered abroad in various universities. Will you change the battery of this? Or just skip through the slide. Can you enter when I say? Now, these are I'll just not go through the details. Various options are available for you to become a hospital CFO. You can become a hospital administrator. You can be even a coordinator in the oncology department. You can do your clinical practice, and in addition to that, you can actually be an administrator. There are various categories there. You can actually become a hospital administrator. Now, this is another big question. Why after MBBS, when we actually have a shortage of doctors, should we deviate ourselves from clinical practice and start an administrative career? But I think next 10 years is going to be the big change in the way healthcare is being delivered in our country. As you all know, private healthcare is leap and frog growing up, and health insurance is picking up. As you all know, currently people pay out of their pocket, but health insurance is going to be the future. With health insurance, there will be tremendous private opportunities coming up your way. And if you are equipped in the right direction with a proper educational background, you could actually stand to gain a lot with technology coming in a big way. You talk about artificial intelligence, you talk about machine learning, robotics. These are the future. So as a medical doctor, if you empower yourself with a medical administrative degree now, next 3 to 4 years down the line, you actually have a very rewarding career. Now, just a few inspiring, I don't know whether you get inspired, but just 2 slides about myself. Now, when I started my clinical practice. I was a doctor for about 10 years when I decided to switch into hospital administration. Now, why I made that? Because I made a problem statement. So to anyone who wants to start a career, think of a problem, make a statement out of it. Once you define the problem statement, you can actually find a solution for it. The solution is going to be $1 million idea. So when I looked at the Indian healthcare scenario, there were huge hospitals, there were small nursing homes, and there were small primary care clinics. But people were actually going into tertiary care hospitals for secondary care treatment. Even now it's happening. So the problem statement is people actually going into tertiary care hospital, paying very high hospital fees. Is that a problem that we could solve? So that was the idea that made me start Dual Hospital. We have 11 hospitals and we feel this is a system process driven organization which is the right model for our country, and we plan to have 500 hospitals in the next 10 years. So this is something, once you define a problem, automatically solutions can be designed and implemented, which can be very rewarding career in terms of you can be actually very happy that you've done something to the society. So thank you all, and I really thank Professor Jailal, Dr. Abulasan, and all the organizing committee of young doctors, and especially Dr. Arun Kumar, who approached me and gave me this opportunity to talk. Thank you all.